Well, good morning, everyone. We'll go ahead and get started. It's just past 8, and this is, I believe, our Maticia. Keep me honest here. I think we're on our 6th meeting. Is that right for our task force?
I think you're correct.
Time is going very quickly. So thank you all. Thanks for all of the work that you are doing. We know this is not limited to a 2-hour session on Friday, but there's a tremendous amount of work going on throughout the week to keep this work going and to be preparing. So thank you all for everything that you are doing for Durham and for the residents of Durham and the broader community. So thank you all. We'll go ahead and get started today with updates from Mayor Schewel and Chair Jacobs.
Thank you, Katie. Wendy, would you like to start?
Sure.
Go for it.
Good morning, everyone. It's always great to see everybody's faces, and I really look forward to this discussion and meeting every week, and really appreciate the work that you are all involved with and the roundtables. And I've just been learning so much from everybody and all the efforts that are underway. I would say for me, the things that I've been thinking a lot about this week is we'll hear more from Rod, but again, what is happening in our Latinx community, the numbers are still increasing to the point that now my last update on our multi-agency call, we were up at 75% of our cases being in the Latinx community. And I think also concerning is I think more and more hospitalizations as well related to this part of our community. And so I think, again, just getting a pulse on, I think we are making some progress. And Rod, I know, and Pilar and others can fill us in. Getting some progress on some steps, getting some more help from the state. I actually just read late last night, that Durham County is going to get $1.3 million of state funding for our public health department. And I hope to learn more about that, maybe from Rod, whoever else knows about it, maybe Jody. Sometimes we don't always get information from the state. It can be kind of indirect how we get it, but that's welcome news. I think we really need more resources, and I hope that they will be coming. The other big thing that I've just been thinking a lot about, and I really would like input from the task force about, is the issue of face coverings. There's been several articles out this week, more studies out this week about how face coverings really work and how important they are. I had shared a story with Katie and Maticia and Steve I've just been resonating with me about a stylist. It was in the Washington Post about a stylist at Great Clips in Springfield, Missouri, who evidently was positive. She had symptoms, but she was wearing a face covering when she interacted with 84 clients. And the clients were also all wearing face coverings. And evidently nobody contracted COVID from her. And I just think that's an incredible story. And as we think about how we live with COVID and we reopen, and our businesses can thrive, it just seems to me that face coverings is one of the most important tools that we have. And I just see less and less compliance in the community. And so I'm just thinking about how can we get that message and that information out to people. that it really does work and it saves lives, and it's a way that we can live with this. And I'm looking forward to Let's Get Back on the Bull as a way to help us with that. But I'm also thinking about enforcement, and I really appreciate the studies that the research that the students are doing for us, and was really interested in the article about New Zealand and how, yes, they had a great leader with things like face coverings, but they actually did have active enforcement. So I'm sure you've heard conversation yesterday, the press conference for the governor. There was a lot of talk about, are we going to have statewide requirement of face coverings? I'm hoping that we will. And obviously good news that Orange County and Raleigh have moved forward with that. But the other question I do have for everybody, again, is thinking about enforcement, compliance, and how do we really get everybody using one of the really only tools that we have right now. So those are my thoughts. And I look forward to more discussion today about those. I'll turn it over to you, Mayor.
Did we lose the mayor? Up there he is.
I made it back somehow. If I repeat anything that Wendy says, forgive me. I'm sorry. My internet crashed out there for a minute. I do want to thank Amber for not only always getting me back on, but getting us all together. The unsung hero of this many times. So thank you, Amber. I didn't hear what's on Wendy's mind except for half of it, but I'll tell you what's on mine, which I'm sure is some of the same things she said. One is just the increase in our Latinx cases, which I know she did talk about, and the increases in our cases in general. I mean, I just got the epidemiological report from Duke last night, and our cases are up 24% in the last week. The states are up about 22%, and that's a lot, and it really gives me a lot of concern. And we have to figure out a way to communicate that well to our community. That Rod reported, I know he'll report in a minute, that on our MAC call, I believe we had 550 cases last week. So we're having a lot of cases, a lot more cases than we had previously had. And this is of great concern. And it also puts pressure on us in different ways. And one of them, of course, is with contact tracers. We continue to need contact tracers, especially people who are Spanish speaking and culturally competent. And Rod is working very hard to make that happen. And I know that Pilar is as well. And we just need to continue to make that effort. I was on a call this week with the governor and the mayors of the what they call the big city mayors. Not that our cities are so big in North Carolina, but that was both myself and the mayor of Fayetteville really stressed pushed very hard on the need for Spanish-speaking contact tracers, and I know that the governor got that message. I do want to say today, maybe it was yesterday, but our small business fund has launched, and that's great. So we will, we're looking forward to having that money allocated for grants and loans, which will be the process is going now, and it will be money out the door in July, which is really important. And then I wanted to also mention progress on the voluntary self-certification, which is great, and progress this week on the PPE for vulnerable populations and the distribution of those, which is going well. And then also the other work on PPE, which is for our small business community. And I wanted to appreciate the work of Ed and Ryan, specifically in pushing this forward towards a online marketplace for our small businesses that would include both local suppliers for people who are in need of smaller amounts, and then so we can include our local suppliers as well as suppliers of larger amounts, some of whom can also be local for those businesses that need large amounts of PPE. So I think we're moving in good direction in a lot of ways, and I appreciate it a lot. But I am very concerned about the new numbers, and I know you all are as well. But I so appreciate your work. Everybody here is just amazing. This has been just a great group, and I'm so grateful. So thank you. And sorry my internet lost you for a second there. Thank you.
Thank you. Thank you both so much for the important updates. I can give a very brief update on the plans for expanded testing, which is part of our vulnerable communities action team. That team met again today, and there have been several meetings through the week of smaller groups working together on logistics around planning expanded testing. So first of all, Lincoln is expanding its testing as we speak. So an additional 150 tests a week through Lincoln, which is excellent. And so thanks to Philip and the team there for being able to do that. And then we are planning in a couple of weeks, actually the week of July 6th, to launch more expanded testing with twice a week sessions. We are looking at Holton Community Center as one location, and then El Centro as the other location. So 2 different locations per week, and working on all of the logistics around that. So really good progress. That will not be done as just testing alone. There needs to be an education component to that. And we've talked a lot about the importance of that. So education component, using that potentially as an opportunity for us to be able to, with the testing, hand out face coverings as well, making sure, and we continue to have conversations about making sure that Rod and the health department have what they need in terms of contact tracers, because it's not simply about testing. We need to have the contact tracing as well for those who test positive, but I think really good progress there. And I would ask if Phil or Rod want to add anything to that, anything I've missed.
I'd like to add that we're also holding conversations with one of our community partners to see if we can add an additional testing site to improve access for especially our African American community.
Excellent. Thank you.
I would also add that we still have some plans in the works with the General Baptist State Convention. We just had to take a quick half step back just to do a little bit more logistical planning. And I do plan to reach out to Dr. Herbert Davis. Hopefully today. We've been kind of missing each other, but we do know that the faith-based community are eager to assist, and we just want to make sure that we plan that accordingly. Thank you.
Great, thank you. Maticia, do you want to update us on the roundtables?
Sure. Good morning, everyone, first of all. As we mentioned last week, we are spending a little bit more time trying to provide some additional structure around the roundtables, and many thanks to Brian and Ryan for their continued support. In your briefing materials for this week, there was the one pager that we referred to last week. And my hope is it was an easier read, it was easier for you to consume. And ultimately, we want to use the one pagers to really drive the discussions here at the task force, help us to focus on those items that we collectively as a task force need to be focused on. And so on our agenda today, we have some time dedicated to doing just that. I do want to touch on another topic, which is, and I think this has come up from several of you, like, when does the roundtable end? And so Katie and I did spend a little bit of time talking about that this week. And, as we look around the task force and even the folks that we've engaged in the community, we have a lot of great leaders that we have engaged. So we're not gonna set a standard to say, your roundtable ends when. we're really going to leave it up to the leaders of the roundtable to determine when the roundtable should, and I'll say a soft end, because we've set these roundtables up for a specific objective. And if you feel like you've met the objective that you were called upon to kind of help us out with, I would say it's okay for the roundtable to stand down, but we always want the roundtable to be available as new issues or concerns come up. We want to be able to tap into the roundtables at any given time. So again, we're going to pretty much leave it up to the leaders of those roundtables to determine, how often you're meeting, and if you want to start to stand down because you feel like you've really met your overall objective, then that's okay. But just know that we can call on you at any given time. And finally, I would like to say, I know many of you are engaged in multiple roundtables, but if you haven't had an opportunity to participate in a roundtable, I would highly encourage you to do so as a task force member, because I think the roundtables really want to see us participate in the roundtable meetings. They want to have firsthand access to task force members. And what I've found from the roundtables that I participated in, it's always really good dialogue. And I learned a lot from the roundtables. So again, if you haven't had an opportunity to engage in a roundtable, and even if you are, please try to engage in some that you haven't, because I think just as being part of this task force, our presence in the roundtables is important, because we have a lot of folks that are working hard to help us accomplish our objectives. So with that said, I'm going to turn it over to Rod to continue to educate us on metrics.
Thank you, Maticia. And again, I say good morning to everyone. Your update for today is as follows. Again, in the United States, we continue to see increases in COVID positive lab results, with 2,155,572 active cases, resulting in 117,632 deaths. Within the state of North Carolina, we're at 48,188 cases of COVID, resulting in 1,175 deaths. In Durham County, yesterday we did tip over the 3,000 mark. We're at 3,006 cases of COVID in Durham County, resulting in 61 deaths. We do have 674 active cases, and we also have 2,269 inactive cases, meaning those many residents have recovered from COVID. That's always good news. In terms of Durham County contact tracing efforts and contacts made to date, we've contacted 3,640 individuals. As far as our partnership with CCNC and utilizing the CCTO platform, we've sent 1,802 cases to CCNC, and they've made about close to 900 contacts. It's important for the task force members and the general public to know that we are in week 3 of our partnership. So we continue to hone and refine our partnership, and I do feel as if things are going well. In addition, the CCNC, CCTO contact tracing staff continues to increase. We will soon have a total of 50 contact tracers. So that's going to add to the 30 we currently have. So we're certainly delighted, and we have been told, as Mayor Shewell has indicated, that the state hears most of our communities loud and clear. And many of the new contact tracers that are coming on board are fluent in conversational Spanish. So we certainly owe a debt of gratitude to our elected officials and to our state leadership for assisting us. I'd also want to note that Durham is one of the few counties that has been successful in working on this platform. I think it's only probably about 5 counties that have been up and running. Durham continues to be the first non-piloted county to use this platform successfully, and we are able to increase our staffing based upon need. Going into the numbers, we did start the week of June 15th off with 2,800 cases total. There was 553 increases in cases from last week. And then again, we want the community at large to know that the number of total cases is cumulative and it will increase daily. So we watch the total number of cases to understand the disease burden in our community. And as the chair and the mayor has indicated, there is cause for concern with this many cases being presented. Our 7-day moving average as of Monday was 80. This is down from an average of 82 last week, and the previous week was 58. So we do see some drop, some decreasing in, which is definitely a good thing. We watch the 7-day average to determine if trends in cases are increasing or decreasing within the community, and we're seeing a slight decrease. So far for the month of June, there were 688 new cases. In terms of metrics and overall status and what it means to our community at large, North Carolina's trajectory of lab confirmed cases is increasing slightly, and Durham's trajectory of lab confirmed cases is increasing as well. In terms of race, ethnicity, and work, we continue to promote health equity, which is central to Durham County, but particularly Durham County Department of Public Health. And we look at race and ethnicity distribution in cases just to ensure that we are able to articulate overrepresentation and underrepresentation. Overrepresentation lets us know who's at greater risk of COVID and who's at lower risk. As it stands for the month of June, most of our cases continues to be in the Hispanic or Latinx community. As of right now, it represents 77% of our cases. Hispanic or Latinx individuals are definitely overrepresented at this particular time. 77% of all cases, with the Latinx community only representing 14% of Durham County residents. Then the Black and African American community, they continue to be underrepresented based upon the data for the month of June. 11% of our cases at present involve the Black or African American community, while they represent 37% of all Durham County residents. In the white community, are very underrepresented, representing 13% of all of our cases, and they currently represent 54% of all Durham County residents. In terms of work, race, ethnicity, and sex, we want to understand common workplace and particularly congregate living settings of COVID-19 transmissions, for they help us to target resources, ensure proper worker protections, and identify root causes of disparities. So far in June, the occurrence are among people who are unemployed, people who work constructions, and people who continue to work in janitorial services. 84% of our cases are associated with unemployment, and they were of the Hispanic or Latinx community, and 65% were female. 88% of our cases were associated with construction work settings, and they were also Hispanic or Latinx, and 90% of those individuals were male. 88% of our cases were associated with janitorial services, and they too were Hispanic or Latinx, representing 92% of their female population. A few notes on this. Nursing care facilities, 84% were residents and 16% were staff. Adults were considered 65, adults who were 65 and older who were listed as unemployed were assumed to be retired. Additional information about surveillance. As it relates to our metrics, again, that third metric, which is total number of lab confirmed cases to include positive and negative, continues to escape us, but we have been assured by the state that they are working on it. The data that they have represents about 75% of all labs. And of course, that's incomplete and inconclusive. However, they are working. I am also happy to report that they did send Durham County a preliminary estimate of all our labs based upon an algorithm that they're developing. I care not to expound on that because, as I aforementioned, it is not complete. So for surveillance, we looked at two things. We continue to look at two things: insured populations and community-based efforts. And our first effort reflects the prevalence of positive tests in the insured population. Again, that is information that we received from Duke University Medical Center. And the positive test prevalence for this population was 14%, which represents a slight decrease from 15% last week. And as far as our community base, that represents the number of different community options to include Walgreens, CVS, and other pharmacies. The positive test prevalence for this population was 12%, which is a decrease from 17% last year. In addition, to these metrics, we just want to report that North Carolina's trajectory of positive tests as a percentage of total tests is increasing slightly. Durham's trajectory of positive tests based upon the 2 surveillance efforts is flattening. In terms of zip codes, I did receive a request from the state this week. They are petitioning the federal government for additional testing sites, and they wanted to know what zip codes have the most need in Durham County. I reported the zip codes of 27703 and 27704 because through our analysis of the data, geomapping, this represents East Durham, and this represents an area in which there is not a whole lot of testing site availability. So again, they also have the highest case rates at 13.77 per 1,000 people. So we certainly hope that the state will assist us with additional efforts. Last but not least, how does our numbers compare to those of the state of North Carolina? Within the state of North Carolina, overall lab confirmed cases continue to increase, with records being set for hospitalizations due to COVID positive individuals. Their average number of cases over 7 days continues to increase. And this is as of reporting that I've received in 2 briefings this week. And based on electronic lab reporting from what they're able to glean, North Carolina's positivity rate continues an upward trend, being at 10%. And also, there are various communities within North Carolina as a whole that continue to see higher rates within the Latinx communities. So therefore, efforts are being made statewide to address our Latinx males and females. This time, I'll definitely be able to open it up for questions. Or I will say, if Dr. Akinboyo has anything to add, she's more than welcome to go.
Good morning, everyone. Thank you, Rod. As always, I think the data speaks for itself, and you do an excellent job just trying to explain the key highlights for the group. The one thing I will just add, I think it's sometimes we mention contact tracing, but maybe we don't highlight, we've highlighted how important it is, but it's important to just kind of go back to the reason why we focus so much on it. We're seeing the numbers creep up, and I do agree, particularly this week. I think the last couple of weeks have been slightly more concerning than prior weeks. One thing we look at is the number of unlinked cases. So as we're performing contact tracing, if we're doing this adequately, we should be able to capture everyone that has the potential to be positive. I don't know that we have that data for everyone yet, but if we have one positive case and we can link them to every positive that week, we're actually doing an excellent job. So we're not at 0, but we're capturing all the potential positives, isolating them early and getting them, limiting transmission that way. So I think as we move forward, the emphasis on contact tracing is really to help reduce transmission and just ensure that we're tracking all the people that need to be tracked and providing resources when and how and in the exact format that they need them. But other than that, I think everything has been well covered, and we can answer questions about some of the epidemiology if they exist.
Thank you both. I do have a general question, and my question may be naive, but I'm going to ask it anyway because I don't know the answer. What I've heard this morning from, I think, Jacobs and Schul and Rod and Dr. Akinboyo is the numbers are going up and it's concerning. So as I think about the task force, what do we do as a task force when we hear the numbers are going up and there's concern? What should we be doing as a task force to address this? I don't know if address this is the right word, but what should we be doing as a task force?
I think that may be a difficult question to answer quickly. I think all of our efforts are we're trying to be cohesive to ensure that if there's something urgent that needs to happen to reduce the rate of infections, then we can do that. I think everything we're doing so far is already trying to achieve that. One action item may be the timing of further lifting of restrictions, and currently it may be worth considering a slight pushback. Whichever date we have floating around, it may be worth considering just a slight pushback on that. And then for some of the other efforts that are ongoing, I know we've talked a lot about resources and targeting the right populations. Ultimately, all of those things, we will see the fruit in about 2 weeks. It's just that this is showing us what has happened over the last 2 weeks, and it suggests that there has been a slight increase. All of our work over this past week, we should see that hopefully play out in the next week or so. And alluding to the numbers, on some level, we will expect that the number of cases may continue to go up for a little bit. It's just ensuring that we're aware of which cases, where they are, which clusters, and not seeing any excess mortality. So we're not seeing our hospitals run out of beds or a high increase in mortality. And I don't think we're seeing that yet. So talking about the concern around numbers is not just to raise panic or fear. I think we are actually staying ahead of this somewhat, and we can't lift our foot off the gas.
Maticia, I would also add that, you know, continue to know and understand the data. And I love the fact that the task force has challenged Dr. Akinboyo and myself to break down the data in a manner in which the community at large can understand, and also to challenge me to put it out there on the data dashboard in the form of a weekly reflection. I believe that my data team has done a fantastic job of making the data totally understandable to the community at large, and just being able to give them a glimpse of what we're seeing over the past 2 weeks or the past week, and helping them to also be public health champions and articulating this to the community, to every sector. So again, we have great representation on the task force. I would just ask that you spread this word and just let folks know about what the numbers are saying, where we are, and particularly the conversations that we're going to have later on about face coverings. It works. It is a public health mitigation strategy that works, and it's tried and true. You look at pictures from the pandemic in 1918, you see them wearing face coverings. So it works, and the stories throughout the country detail that. So we just really need your assistance in really spreading it to your spheres of influence, because again, public health and public health department can't do it all. It takes a community that, I would say it takes a well-informed community in order to tamper this down.
May I ask a question, please? This is Lois. Can you speak to the accessibility of testing for individuals who do not have active symptoms, or who haven't necessarily been in close proximity to someone who is positive?
I can, and thank you, Lois, for that question. I will say that testing is accessible. Of course, again, we do follow the CDC guidelines, and it's my understanding that CDC guidelines have changed. They're ever changing, but they've changed for asymptomatic individuals. Testing is always available for people who feel that they may need it. But again, with Walgreens and CVS, there are criteria. So in other words, like when they go online, they will have to, fill out a survey to determine whether or not they're a qualified candidate or a good candidate, if you will. So again, if those individuals have insurance, they're more than welcome to request that testing. And again, with the change in CDC guidelines, from what I've been told, if you're asymptomatic, they're now wanting you to self-monitor. So in other words, like you check in, making sure that you don't have any of the symptoms. And anytime that there's any type of slight change, then that's when you should request a change or request a test. But as it stands right now, again, testing is in abundance. There's a lot of capacity for testing, Lois. But again, we're not like we were, several months ago, where we really wanted only those people who are truly experiencing symptoms. But it's out there, it's available. But again, the CDC guidelines, you just want to make sure you follow those to the letter.
And the other quick follow-up there is, I just forwarded to you, Rod, who monitors or helps with sites, non-medical sites that are providing testing? For example, I just forwarded, I think it was a church group that was providing testing, but the form that was required for people to fill out asked for their social security numbers. So
I've not had an opportunity. Well, thank you for forwarding that to me. I've not had an opportunity to look at that. I'd be more than happy to review that, Lois, and get back with you after the task force meeting. I will say that is concerning because we should not be asking for that particular type of information. So that's very concerning. So I would definitely love to be able to investigate that a little further and take that higher if I need to.
I would like, good morning, everybody. I would like to say that, I think we've been doing a lot to try to contain this, but I think, of course, we need to do more. And I think testing is one of the things, so we are addressing that. Also the communications, and I know we are working on that too. And from our side, Monday, we are going to launch our communications campaign with the Spanish media outlets. So hopefully that will help. Another thing I think is we need to have in mind is, and I know it's a conversation we will be having, is going to the next phase, because I think one of the issues is also people feel if things are open, we don't have the virus anymore out there. So I think that piece also, we need to work on that. About the face masks, I think, I don't know why, I know we were the first ones recommending mandatory using the face masks, but now that Orange County came out on the news, and now Raleigh, and I've had a lot of questions, when is Durham doing it? So it's clear we need to reiterate that we were the first ones and it is recommended, because people are asking that, and I'm like, okay, we did it. And again, with all the media. And also, the other thing, I think it's hard to come up with the solution, but isolating people, I think we need to continue thinking about that and find ways to help the community members. If they need to isolate, they really have an option for that. I think that piece, we need to work more on that. And the other thing, we were with volunteers yesterday bringing masks to Latino businesses in different areas. And what I found is, first, they couldn't believe it was for free. As soon as I got into one of the places, they look at me like, what do you want? And I was asking about the face masks, and the majority were using face masks, which is great. But then they were asking how much I was charging for it, or if I needed a contribution for the masks. When I said, no, they are for free, and I explained, and these are reusable, they were very well received. But at the beginning but I also found places where they weren't using masks, neither the clients, neither the people in the store. So I think that comes to me. And also the other point for that is yesterday in our immigrant and refugee roundtable, had an elder lady from the Latinx community come in. She tested positive, and she didn't know anything about COVID. So that means not everybody's getting all the information. So those 2 points about that I mentioned is telling me that I know from one side scary, from other side resources, and we are telling people to maintain distance and avoid going out. But I think we need to do more outreach, going to the community it's difficult. I know, even from our side, I've been having this conversation with our staff and some volunteers, but I think we need to start going out and talk to the community directly, plus the communication piece. But also that brings us to resources. Yes, so we need to pull volunteers. Our staff is, and I know from the organizations up, with a lot of work, but how can we incentivize some volunteers or some people from the community to help us do this outreach? Because I think that's a big point for this.
Pilar, this is Susan. Thank you for that. When we get to the right point in the agenda, I wanted to talk a little bit about reach on behalf of the communications team. Pilar has really been representing the Hispanic community for that team really well. But I think this task force needs to talk a little bit about what our plan is for reach. I wanted to ask a question about the numbers. I really appreciate the detail in these numbers and the importance of that. How this situation populations, different types of work environments, things like that. Can you help me?
Hey, Susan.
Yes.
I think, okay, you sound really clear now. We were having a real hard time hearing you. Could you repeat your question?
Yes. I have great connection except when I'm trying to speak. I don't know what happened there. I was just saying I appreciate how important the breakdown of all these numbers are, but I would also say as a communications person here that we need to understand what the headlines are. The general public is only going to absorb 1 or 2 numbers. And in that great presentation, I heard cases are up 25% from Mayor Schul. I heard cases are up slightly. I heard they're down slightly. I heard they're flattening. What is the number? If you just have 2 takeaways, what are those 2 takeaways in terms of the direction of our cases and what that means?
That's a great way of saying, like, what would be the headline in the Durham Herald Sun or the News and Observer, and it's more or less along the lines of Durham continues to work hard, however cases are increasing, and we are concerned. Again, I think it's important. I know the mayor and the chair has said it, but it's important that the public health director says it as well. There is concern because again, this is while we're not, for example, we're not like the city of New Orleans, a city of 410,000, but they saw average, in the height of the epidemic, they saw 450 cases per day. We're not there. We're not there. So that's for reassurance purposes. But there have been days when we have seen like 100 cases per day. And of course, that's concerning. So while the numbers are not necessarily pretty, they tend to go up, they tend to go down. I think as of this week, toward the end of this week, we're starting to see slight dips within the numbers. However, we have to give you the raw data from what we're seeing last week, and last week was not pretty. So to that regard, I think the efforts that we're making as a task force and all the things that we're doing in our partnerships and our healthcare coalitions are working. And as Dr. Akinboyo has said, again, we will go through a period where there's a steady rise, but then we also will go through a period where we'll start to see the numbers come down, and we're looking forward to that. But I thank you so much. And to my 2 co-chairs, I could sit here and talk COVID all day long. There are some important updates that I'd like to give, but I try to be as respectful as I can to time because I know we have a lot to cover. But this week also was a great week of accomplishments in terms of things that are coming from the state. And hopefully, if time permits, at the end, I'd like to expound on those things.
That sounds great. Thank you. Thank you so much. And really good dialogue, really good questions. So appreciate it. I would like to transition us into the discussion around face coverings because I think that, and certainly I can get on my soapbox a little bit about the importance of wearing face coverings. To me, wearing a face covering is an act of kindness. It's what we can do for our community, right? it's a very simple thing for each of us to do. It's a simple way for us to be able to give to others, is to wear that face covering. I would love to ask Dr. Akinboyo to talk a little bit about how face coverings work, why they're so important, why we keep stressing them so much, if you could.
Yes, I can. I should also say I am heavily biased towards face covering, as I'm sure all of you here would expect. So I will, I guess, try and leave 1 or 2 minutes to account for some of the issues that people have had with face coverings. But I think the general idea here is that when we talk, when we interact, certainly when we cough and sneeze, and that we're more attuned to, we all release droplets. And those tiny droplets can sometimes drop right in front of you and others around you. But every so often, if you're in the right setting, if you sneeze out, it can travel very short distances and potentially infect someone close to you if you're also infected. So the idea behind face coverings is, particularly with COVID-19, if we do not know when we get infected, if some people are asymptomatic, or if you have just a mild enough symptom, maybe a slight sore throat, maybe you had what you might call sniffles, or some people are still referring to them as allergies if they have abnormal symptoms, and you're going about your day-to-day life, such as going to the grocery store, or even as some people are going back into a group setting, work or school or camp. You may interact with people closer than 6 feet. So staying 6 feet away does help. We do not expect droplets to travel far distances. But if you are interacting in shorter distances, say for example, less than 3 feet, just to toss another number out there, and you're talking or you potentially cough or sneeze, you may spit out more than you're aware of. And if you have any face covering, that just limits that to yourself. It keeps all of the things we share with each other, whether we realize it or not, keeps it to ourselves. And by definition, that will reduce the number of people that are infected. And I thank Commissioner Wendy for bringing up the article that came out regarding the hairdresser. And I think the key number there is the fact that, as far as we know today, after interacting, there were actually 2 hairdressers, I think, and after interacting with almost 140 different people in pretty close settings, just think of getting your hair cut or washed, not one of them so far have been infected or diagnosed with COVID-19. Now, of course, they're testing people that are symptomatic. So some have argued that you could have had asymptomatic people get infected and we just missed it. And I think they actually tested a few more people that had relatively mild symptoms, and none of them have been infected so far. That is a testament to face coverings, and one that shows that as we slowly reopen, as we have to interact with more and more people, particularly when you come if you come closer than 6 feet, I think a face covering is extremely important. And when you cannot expect when you're going to be in a distance that's shorter than 6 feet. Say you're doing your best to stay away from someone at the grocery store, but someone comes closer. That's the whole idea why we just say, if you're in a group setting of any sort, just put it on, and that way you don't have to wait for the situation before you put on a face covering. So a couple of controversial areas. Some people are just not used to having something on their face. Some people are worried that it would affect their breathing. I certainly am biased to being in healthcare, and we wear masks all day, every day for different reasons. And for the most part, if you have a regular mask, it should be breathable. If you have something on your face, we preferentially suggest the cotton material, because that also just helps with breathing. And I think most of the reusable masks out there tend to be of lighter material, and anything that can easily sit on the face should be safe. If you have any trouble breathing, of course, if at all possible, you can remove the mask and make sure you seek help in a setting that's safe for you. I think the other thing has been about people that are unable to take a mask off by themselves, either for their age, so younger children, for developmental disabilities or anything like that. We do not want to create a situation where someone is unsafe. So face covering should be used for those that can actually remove the mask if they're having any trouble breathing. Roughly, children less than 2 Some might have kids that are even 5 and are unable to cooperate with that, and that's fine. And so we're advocating for face covering, but also keeping distance from people that are not within your household when you can. And I think the other thing has just been, if you do not have access to face coverings, and I'm well aware that some people still have just not been able to make something at home or have a mask that they feel safe using. And some of us on the call have already talked about the different ways you can get access to a free face covering of some sort, or free mask. And I think most businesses, I haven't been out and about as much, so I can't speak for what's going on everywhere, but I think a few businesses have started to hand out some masks for free as a way to help this out. And I've seen that done in some places. I'm not sure how they incorporating the cost into their business workflow, but that may be something that if you could support a business as a way to enforce it, could actually just hand out a mask as patrons are coming in. So I think that sort of highlights the point. And then just one last point I will make is, we've said often that wearing a face covering protects everyone else around you. And I think to some extent, I would like to emphasize that it also protects you. And this is just think of it as simply as you can. If you are wearing anything that covers your face and someone just happens to sneeze in your direction, technically you're also slightly covered. And so you're not just breathing in the entire thing that comes your way. So it's a subtle point there. And the key part of wearing the face covering is certainly to ensure that you're not infecting other people around you, but there is some sort of protection for you as well. So it goes both ways. And so until we get a handle on this virus, one of our strategies to really get this out of our communities would be to wear face coverings in all of our outdoor settings, or all of the, just to rephrase that, so anywhere where you're in a group setting with other people, so outside of your household. Think outside, if you're truly just outdoors, you may be fine since there's a lot of air movement. Are there any questions regarding that?
That was a great overview. Thank you so much. So I think, and I appreciate you talking about how we can encourage and how businesses may be able to encourage, even by handing out face masks if they have them available. But I'd love to spend a few minutes with the task force thinking about how we encourage voluntary compliance with this, and how we get the message out to people about why this is important and that it is an act of caring. And it is protecting ourselves too, to some extent. So would love to just get thoughts and have that discussion.
Yeah, I'm wondering, is Mariel with us today? I don't know if she is on the call with us today. Because there had been some discussion over email about this, and I guess I'm not clear if, for instance, Pilar, when you were handing out face coverings this week, are we giving any public education information with that about, how to wear them, but also why it's important to wear face coverings?
Yes, so every time we give the masks, we are saying, and there is a little flyer that comes with the mask. Yeah,
Okay.
saying all of that, and even how to wash them, but why it's important. And again, repeating the 3 W's. Yeah.
Okay, great. Because I think, obviously, I'm just thinking about every point of interaction that we have with people, whether it's when you're handing out a face covering, or even at the point of people coming in to get tested. I don't know right now what type of information is even being given to people at Walgreens or CVS or anywhere. Is that even a possible point of contact where some basic, information could be given to people about things like face coverings and other ways to keep safe? I would love to hear ideas from task force members about, how we get the word out into the community but also the messaging. I really liked what Katie, what you said about face coverings is an act of kindness. And I don't know if the Get Out, the Bull campaign will maybe allow us some type of, almost marketing messaging that we really to promote, and whether it's going to take some money, if we things like billboards and radio, but Pilar, hearing you say that people don't know that it's required in Durham when it has been required since March 28th in Durham. We have been the only county in the state that has required this since the very beginning. And so that shows me that we need to do a better job of and continually stress this. So this is so important. And Dr. Akinboyo, when you were speaking too, I read an article this week about, how, covering the nose is so important, and how people are not properly wearing the face coverings, and why everything seems to be, there's new research about, the nose, and even showing drips down from the nasal passages into the lungs, and how, so we really need to cover our noses. But so again, just would love to hear people's ideas about how we can address this.
Yeah, I think that's important. The face covering needs to cover like this, right? Having it, if I have it down here, which is what I sometimes see, that is not enough. And even down like this, my nose is still not covered. It really needs to cover. I think I have this on, I'm going to look to our health experts, but needs to cover like this.
Yes, that's correct. So it's not just having a face covering. I think we've seen face coverings used as headbands, as neckties, and all of that, and it just defeats the purpose. A face covering has to cover your nose and mouth, particularly when speaking. And yes, you may have to adjust it every so often, and that's why we're not going to stop you from all the other things we've talked about, which is wash your hands and stay away when you can, but use a face covering when you're talking, interacting, and I hope no one is coughing and sneezing at people without covering in some way, but particularly if that's happening as well. I think there are lots of ways. I can't speak to Walgreens or CVS right now as to the education that's handed out. I may defer to anyone else on the call that may have closer contact with them, but I think all of the clinical centers have a handout of some sort. There's verbal education about face covering, isolation, and the continued use of face covering even after your period of isolation ends. So I'm pretty sure the health department as well, Duke certainly does, and I know Lincoln as well. I'm sure CVS has something, and the Walgreens probably has something. But you're right, it goes hand in hand. We hand out face coverings, we educate to it, and that education needs to continue as we hit flu season coming up in the fall.
One quick thing is the other question we a lot, and I think it's important to clarify in the educational pieces is how long you can use that mask. And I know it is different depending on the mask, and when they need to throw it out or wash it or whatever, because there are many different masks. And I think we need to be clear about it, because I don't know if everybody's clear about that piece.
One quick answer, it's really hard to answer this for every mask out there, but as long as the structural integrity is intact and it's not visibly soiled, you can likely reuse it. If you're in a healthcare setting we have different rules for most healthcare settings, and that would apply to, I think, nursing homes or other group settings. But just in your day-to-day life, if it's still intact and not visibly soiled, you're probably fine.
One of the things I want to talk about is how we can get the message out on the media. And so early on, when we did start the mask requirement, I asked Coach K, Coach Cutcliffe, and Coach Moten from Central to make spots for us. If they masked up and they said, they gave a message about putting on a mask, and it was very simple. But we have, that we use that very briefly. I'm convinced that the state is going to roll out a face covering requirement soon. And I was thinking that those people and some others could be actually part of a statewide campaign. They have, they're not just Durham folks, they have mass followings around our state. And I was trying to think about, Susan, I was thinking that you all might want to, originally we reached out to our television stations and they did a little bit of running that, but those still exist. And there are probably other people that we could also recruit to do that have a mass reach. And so just wanted to think about that as well. And I'm happy to be involved, Susan, if it's helpful to reach out to our television stations and other ways in which you think that we ought to try to make that happen.
I appreciate that, and we certainly could have some conversation with them. This might be a good time for me to just give you a few headlines on the communications efforts and what we're seeing. We pulled together this communications team and asked everyone to identify all the channels that they have accessible to them through social media and email. And without any promotional dollars, if we just go with organic posts, we might reach 50,000 people, which obviously is a small percentage of people living in Durham. The idea of approaching the paid media and asking for PSAs, free media time, is one we can try. We're a little concerned that if they do it for Durham, they'll be asked to do it for everyone. And that we're likely to get some resistance to that. But we certainly can make that ask and see. And to your point, Mary Schul, if it were a statewide campaign, that might be something that would carry some weight. We appreciate that. But we have looked at what would it take to reach all of Durham. And I think this is an important question for this task force about how important is it. The beautiful website with fantastic information that CAH has created is great, but you have to have some means to get people to the website. So you have to have some outreach. And so what we've looked at is we can boost social media posts. If you put even just a little bit of money behind social, it gets seen by many more people. That's how those platforms work. And it's like $12,500 to reach probably 60% of Durham, roughly speaking, through social media, which is about all the people who are on social media. So if we want to reach more like 90% of the population, do we want to reach 95% of the population? When I think about the woman Pilar was talking about who wasn't familiar with COVID, if you want to get to everyone in the population, then you really have to have some broadcast media or outdoor or some other mass media forms. And the other thing is you can't reach people one time. Clearly, this is going to be an ongoing campaign. For a communication like this, overall, you'd expect to want to reach people about 6 times. And I think every time the message needs to change, that means there needs to be another grouping of communications to really hammer home these messages. So we are prepared to create a full media plan. I know we're trying to do this as inexpensively as possible. But our thought is just to reach the social media people 6 times would be about $75,000. If we want to go to broadcast campaigns, the starting point would probably be $100,000 to be able to get messages out. And so that's something that I think we need to wrestle with, like what is the acceptable amount of reach that we want to have in Durham? And then we'll do our very best to keep the cost as low as possible and use all the organic channels we have available to each other, to our team. But we also need to think about, how much more do we want to do with that? And I don't know if this is the right time to have that conversation or you want to do that later in the agenda, but it's really critical from a communication standpoint.
Absolutely. No, I agree. I think that's a really important conversation. And I don't know, I would look to our mayor and our chair to see, are there dollars available? And if so, how do we tap into those to be able to try to get this message out more broadly? because I agree. I think in order to really get the message out, there probably does need to be some type of paid.
So this is Marielle quickly before we kind of dive too deeply into this space. I kind of, from a behavioral science perspective, want to like raise a flag that if we put all of our baskets in education, it's likely going to be a small effect. So education campaigns that are really focused on educating the population on what to do have been shown to have, you know, some effects, but fairly small on sustained behavior change. So I just want to kind of throw that out there, that likely the biggest barriers to people wearing masks in Durham is probably not education. For some portions of the population, that might be a barrier, but much more likely it's because people don't have a mask. It's because they forget to bring or wear their mask, because it's very easy to just forget it at home when you go out somewhere. And number three is that it's actually very uncomfortable to wear. And when you think about people who are working and need to be wearing their mask all day, it's a completely different ask to ask somebody to put on a mask for 15 minutes when they go into a store to do their shopping. It is very different to ask a line cook to be wearing a mask while they're in the kitchen all day hot, similarly in a construction site. And so education aren't things that will address any of those three barriers. And so I think we need to also have really key strategies on how we're going to address those three issues. And some of them is going to be really tough, right? The discomfort of masks is going to be a very tough barrier to fight. And it might be things about, you know, whether it's a harm reduction strategy that says, you know, okay, if these are the conditions, then you can, maybe it's that they're taking breaks, you know, we're building in breaks into their schedule more so that they can go outside and take their mask off for 15 minutes before going back into the kitchen. But you sort of, I just want to not put all of our baskets in an education campaign, all of our eggs in that basket rather.
Thank you for that. I will say, you know, certainly though, you know, we've required universal masking of all team members within Duke Health since March 31st. And we, now it is a requirement, right? It's a requirement, but I understand the piece around the discomfort of the mask, but people are getting used to it. So some of this is about getting used to it.
Very much. But I also think that one of the things that allows people to tolerate discomfort is understanding that they have an extremely high risk level. That is very different for somebody who's like, I'm working with 2 other people in a kitchen. Like, what are the chances that I'm actually going to get it? And therefore they're willing to make more compromises on comfort. Because like, we naturally don't understand risk well, even when we hear about it, even when we're told in the news about it. It maybe happens for a minute where our risk perception is elevated, but then it decays pretty quickly. And the more that we cheat on that behavior, the more that we actually go out without a mask, the more interactions we have where we don't wear masks and we don't get sick, it reinforces our belief that it's not that risky. And so it is actually this sort of perpetuating cycle that makes it very difficult to comply.
Along those lines, can someone speak to how consistent are businesses in their messaging, signage, for example, saying when you get to the door of the business, masks are required, and what businesses are doing around trying to encourage voluntary cooperation? I only ask because I walked into the CVS yesterday and there were a couple of people with masks around their chins, and clearly the worker clerk did not, say anything to them. So I'm just curious about what businesses are doing and what level of consistency there is in that industry. Excuse me.
So we've done a few very informal audits where we sort of visited different businesses to see what they were doing, see what signage they had, and it's extremely varied. So there are some businesses that have large, clear signage. They've taped out on the floor, stop before you even enter the floor, because there's somebody who's going to actually verify that you've got your mask, that there's only a certain number of people in the store. And they're stopping everybody that comes in and then one at a time saying, yep, you can come in. There's some stores that have, somebody who's at the door and it's allowing people in and also saying, great, you've got your mask, you can only come if you have your mask. There are other stores that are, that have a sign posted. It might be, not incredibly visually pleasing. It might be just text written on this is what your requirements are. It might only be in English. And one story even told us that they were told that as long as they had the sign posted, they were complying with the local ordinance, that they had no obligation to actually ask people to wear masks. And so, whereas other people were like, yeah, it's required to wear a mask, you have to wear a mask to come into our store. And so there's a very wide variety of how businesses are interpreting the ordinance and even locally enforcing it within their own domain.
We've heard that on a number of roundtables also, that especially in a customer focused kind of business, they are very uncomfortable with telling their customers that they're not compliant or that they have to wear a mask to be there. So I think us helping them with the messaging, to Mariel's point, and with signage would be very useful.
So I'm going to look to, I guess, maybe to you, Susan, and to Ryan around, when I think about the Back on the Bull campaign, there is some signage in there around, embedded within it is signage around wearing a mask, but it's not in your face around, literally around wearing a mask, sorry. I don't know if that's an opportunity we have or what. I guess it would be helpful to know what type of signage would be helpful for businesses to be able to reinforce this messaging, and what types of words that, we could come up with, sort of words that work that we can provide to every business for how to have that conversation, probably similar to back when we went to, no smoking in restaurants, and how they had to have those conversations at that time. Because I assume that there would be some level of comfort if someone started to light up in a restaurant, that they would feel pretty comfortable saying, I'm sorry, you can't do that. So how do we give them those similar words around wearing a mask?
That's definitely something we're working on, Katie. So I will just say, yes, we're working on thinking about what signage and then what types of supporting language we could provide. So we'll make progress on that. Thank you.
Mariel, will that help us? Because that's what I think.
Yeah. Yeah, I mean, I think that will help. And within the Back on the Bull, campaign and the checklist tool, the different things that we're asking people to commit to when there is something like post a visible sign about wearing masks, that will actually be a hyperlink to what we think are some best in class examples. So we're not necessarily recreating. There's a lot of really great created signage out there, but we are trying to link people to what we think are some of the more best in class signage to try to make it easier for businesses to do. And this will be a resource that continues to grow, and we'll continue to add links and such to it as there are better and more clever ways that people are creating those messaging. So yeah, the short answer is yes, definitely. I think the other thing is that another major thing that is going to really increase adherence and compliance is social cues. And so the more that we can highlight and sort of take pictures and showcase people that are like doing it in the right way. And that is a component of the Back on the Bull, both citizens and businesses who are wearing masks, doing the things that they're supposed to be doing, and highlighting those, I think is also going to be a really important component of this.
So catch people doing something good.
Exactly. And unfortunately, right, this is one of the real challenges. So behavioral science has, one of the most robust findings in behavioral science is this around social proof, that we really look to others for cues at what we should be doing. But that also means that if you really elevate and make visible the things that people are doing poorly, you're going to get more people to do the poor thing. And so it's really unfortunate when you see all the news articles about how, look at this crowded beach and nobody's wearing a mask, because what you are actually communicating is that, yeah, sure, these are deviants, but look, most people are deviants, so it's fine to be a deviant. And so you're really sort of saying that it's okay, it's normal to not do that. And really what you want to do is highlight all the people that are doing the right thing. rather than trying to call out the people that are doing the wrong thing.
Okay.
So I wanted to respond to a couple of things. One is Susan, what Susan was talking about, budget, and Katie, you asked about that. I mean, that's something that we can talk about. You know, we need to figure out what our financial need is, and then we can figure out if there are ways that we can meet it. But, you know, so far the task force has operated on very little money. We've essentially funded the language access, and that's about it. But we can certainly do more. We just will need to figure out what that might be and what the priorities are. And I just wanted to ask this question of Marielle, so, or for others that may have some thoughts about it as well. So what we're saying about Back on the Bull is everything is voluntary, but we also, of course, have some regulatory authority with our order. Would it be helpful to mandate, you know, once we have the right signage, that we set, you know, we require that of you know, of stores? Is that, would that be useful?
So I think one of the, so my concern about making things mandatory is that when things are mandatory, you have to be able to enforce it. Because making it mandatory with no teeth is basically where people don't think that it's mandatory, right? This is what, you know, people didn't think that wearing a mask was mandatory in Durham because it's not being enforced anywhere. And so if you say something's mandatory, but then there's absolutely zero enforcement, and by enforcement, like, just to be clear, I'm not talking policing, ticketing, arresting, like any of that. It's basically just denying entry to public spaces. And really it's, you know, our approach also is not to just say, no, you can't come in, but you actually give people a range of options. So instead of saying, no, you can't come in, you could say, okay, well, your options are here. You can take one of our disposable masks to come in. You can order and we'll bring something out to you. You can order online and we'll bring something out to you. You can return when you have your own mask, or you can choose to go someplace else. But you present it as a range of choices rather than just saying you can't come in if you don't have a mask. And that will likely increase compliance. But there has to be some sort of a, but the problem is that any type of mandatory requirement, if there's no teeth to it, then there's no point in making it mandatory. And I think I would just have a really hard time seeing us being able to enforce people actually completing the Back on the Bull and using the same signage. That feels much harder to do, and it would take a lot of time, effort, energy, and probably dollars to enforce it, which would be really the only benefit of making it mandatory versus having it be voluntary, but really increasing the social pressure to do it because it seems like everybody else is doing it.
Thank you. That was helpful.
Other questions on this?
I have a question, which, I mean, I feel like, I guess one of my questions is, and it's related to, you know, the fact that that yes, it is, I acknowledge that it is hard for people who are out working every day to adjust to wearing face coverings. But I feel like, you know, going back to the behavioral science part of it is that like anything else, people are going to do things if they're motivated to do it. And so, you know, here we are at a time where our numbers are increasing, where, you know, we really need to realize that if we really want to reopen, that reopening is tied to us being able to get a control on the numbers and the spread. So, you know, how at this point do we really motivate people to wear face coverings? Because number one, it really is going to maybe save your life or save somebody else's life. Like, it's really works. And also, if you want us to reopen our businesses, if you want things to somehow get back to normal, this is one of the only ways that we have to do it. How do we really start to link those things together? Because when I think about us, living again with this, virus until we have a vaccine in any real sustainable way, it is absolutely linked to everybody wearing face coverings. And, I think it's very dangerous where we're at right now, where people think, oh, we're reopening, and so that means that things are okay and I don't need to be careful anymore or wear a face covering. That's very frightening to me. And so again, how do we get back to the internal motivation and linking together these personal and also broader issues?
Yeah, so motivation is an incredibly powerful thing, right? I think we all know that. We can all attest to times and moments where we've been extremely motivated to do something. But the challenge is that motivation is also fleeting. And so there's this, one of my favorite quotes is from Zig Ziglar. And some of you might have heard me say this before, but basically he says, people say that motivation doesn't last. Well, neither does bathing, which is why we recommend it daily. And so the idea is that you can't expect to provide a message once and that will motivate somebody and that motivation will hold. It is about that daily reminder of that motivation. And that is essentially, so it's about sort of that, repeated messaging, to Susan's earlier point, that you can't expect to just provide a message once and that's going to be enough to motivate people. It will that day. The day that they hear it, they'll feel very motivated. But tomorrow they've got other pressing demands and they've got other pressing things that they need to think about and deal with. And one of the ways to do that daily motivation without having to, constantly spend money on it is again, making it easy for people so that every time they see their mask hanging on their front door when they're about to leave the house, it reminds them of that motivation. It is that every time they walk into a store and they see somebody else wearing a mask, it reminds them of that motivation. So it's all of these other things also are about reminding and reinforcing that motivation, because it alone won't hold.
Great, thank you. All right, so I want to make sure we've got some next steps from this, because I really do think this is critical to our ability to be able to move forward. I agree. I mean, we are going to have to continue to motivate around wearing face coverings. They're here to stay, at least for the foreseeable future. And so, so I'm hearing certainly there is a communication component of this, and we can have some offline discussion with Susan and Chair Jacobs and Mayor Schewel about what may be available and what may be needed in terms of potential dollars to support some type of campaign around that. And then continuing to work with Ryan and Marielle around the Back on the Bull campaign and how that will help with sort of the businesses and providing the information to the businesses. And then maybe there's something we can do even with working with our media. Certainly we can look at PSAs and other earned media, if you will, but how do we begin to reinforce with images of people wearing face coverings so that it reinforces in a positive way that this is the thing to do, as opposed to always talking about those who are not and showing images of those who are, I think, Mariel, you said the deviant behavior as opposed to the positive behavior. Did I miss anything in terms of next steps on that?
Well, I think that one other thing that I heard from Pilar is the necessity of actual in-person outreach in our Latinx community and maybe other communities as well. Excuse me. And so this might mean a volunteer effort. She talked about a volunteer effort, and I think that that's something that we should figure out how to try to support. And that seems really important also for the businesses and maybe not just the businesses. I mean, I'd like to, at some point, you know, kind of understand more about what that would look like, Pilar. Who needs to be reached and how you think that might happen. But I would just add that to the list.
And I think Reverend Davis may have had to step off, or I don't see him on here right now, but also how do we work with our faith community around this? Because they can really help us reinforce that message and the positive, again, so that positive reinforcement.
And then I think, Katie, also the work that we are doing to get the online marketplace up, I think is really important. And, you know, this just highlights that, the making the face coverings available to businesses in a way that's easy.
Right. Thank you. So I want to move us over to, because we've had great dialogue. We're a little bit behind on the agenda. So I'm going to turn it over to Maticia to talk about phase 3.
Thanks, Katie. I think the topics that we've already talked about plays really well into having this conversation about whatever the next phase is going to be, because I think as we talk about our metrics, we had a robust conversation about face coverings. Those are all things that we should be taking into consideration as we think about what the next phase may be. So when Governor Cooper announced that we were moving to phase 2, that was effective May 22nd. And he shared that that order would likely be in place for about 5 weeks. So 5 weeks means we could get an update next week on what the next phase for the state may look like. We wanted to spend some time today just talking about or soliciting your thoughts on what could possibly be in the next phase, because if you think about why we've all been called together as this task force, we're an advisory body that's advising Mayor Schul and Commissioner Jacobs on the best way to keep Durham safe as we recover and renew. And, you know, we have to take into consideration lots of things like our metrics, like our voluntary compliance with wearing face coverings as we make recommendations as we move forward. As I said last week, we don't know what may be in the next phase, but I think we could have some conversations and you can share your concerns, you can ask any questions about what you think could possibly be in the next phase. You know, as I think about kind of where we are and where we could possibly go, and again, I don't know, this is just me speculating, but as the plan was laid out, phase 2 and phase 3, the initial intent was once you got to phase 3, you would start increasing capacity in places like restaurants. And if you think about phase 2, during phase 2, bars and nightclubs and gyms and health clubs were supposed to open, but they didn't. So that could be something else that happens in the next phase. Phase 3 was also designed to increase the number of people allowed at gatherings. And so just wanted to solicit your thoughts, solicit your concerns that you may have as we consider possibly moving to another phase, especially given all the context that you had today and from our meetings that we've had in the past, as it relates to number of cases increasing, as it relates to our ability to get our Durham community to voluntarily comply with wearing face coverings. And since we talked about this last week and I gave this to you guys as a homework assignment, I know you've thought about it hard and you're just eager to start talking. So I will open it up for anyone to start sharing your thoughts or concerns or questions.
So this is Marielle. I have a quick question. So, you know, a lot of businesses have chosen, who technically could be in phase 2, have chosen not to because they don't actually believe that it's safe to be in phase 2. And so I'm just curious about how, if we move to phase 3, how we're going to communicate that it is actually safe to be, for businesses to be moving into that phase when, you know, we're also telling them at the same time that case numbers are rising, et cetera. And I guess, like, from, you know, and I tend to be a data focused person, so I really appreciate all of the data share outs, but Like for me, I would be wanting to know, like, what are the KPIs that basically we're tracking that say, great, we've now done this for 14 straight days, which is why we're moving into the next phase, rather than making it feel like an arbitrary decision. And I think that's really important to communicate back out to the population and to businesses that the decision to move into phase 3 is not an arbitrary decision that just has to do with because so many weeks have passed by, but it really is based in the data that we're seeing. And I just don't know if that's happening in the plan or what that plan about that is.
Renewal, I think that's an excellent point. And I think as a task force, that's one of the things that we need to get our arms around so that we're able to say to Mayor Schul and Chair Jacobs and be able to look them straight in the face and say, we think we should proceed because of these reasons, not just because it's been ordered for the state. We need to have some type of basis for any recommendations that we make to Mayor Schul and Chair Jacobs. And I agree with you, you do have the, businesses or restaurants that haven't opened. And I think what I've heard also is it's not just the restaurant that has the fear, it is the people that work there that they also have that fear. They're not willing to put themselves at what they think is risk at this time. But that's a very good point.
Yes, for me personally, I feel we are in this situation. We are trying to tell people to maintain, do the 3 Ws, and at the same time, for the Latinx community, we are seeing all these cases and now opening more. It's kind of contradict. I can't come up with the word, contradict the fact that we are saying that. Wait a minute, in one hand, we are seeing all these, you're telling us to do this, and now in the other hand, everything is open, more people can gather. So it's, contradictory, I guess.
All right, thank you for that, Pilar.
I cannot speak to all of the nuances of how the phases work, but I think the data, we were challenged to come up with some data points. I think Mario referred to them as sort of the key performance indicators to help guide our understanding of COVID-19 in Durham. And even if we just focus on 2 of them, which is the proportion we're seeing as compared to the last 2 weeks, when we were probably phase 1 versus phase 2, more likely phase 2 in the state, it does not suggest that we have reached a point where the restrictions need to be lifted, but there are always multiple.
We're having a very hard time hearing you, Dr. Akinboyo.
Sorry, I might be cutting in and out. I will just say that the data does not suggest that we are there yet.
Okay. Thank you.
Dr.
I also
Akinboyo.
wanted to say that I agree with Marielle that the business owners are certainly individuals that need to be considered in this, and what's their confidence level, as well as the employees. But there's a third component, and that is the customers. What is their confidence level? You may open up the restaurants, you may open up the facilities, but what's their confidence level? How can we assure them that it's safe? So I think that's the major component in all of this. So any information that we can share, or data or KPIs that we can share with the customers, I think is very critical.
Thank you. Go ahead, Susan.
I agree with all of those points, and I would also say that people are raising questions in the roundtables about what's going to be in phase 3, and everyone recognizes that this is really difficult to try and predict what we're going to do later or when it's going to happen. If there were a way to be able to say, these are the KPIs we're trying to follow, and if we hit this, then in phase 3, this can happen. Anything that we can do to give people an awareness, even if we can't say when phase 3 will start, if we can say, here's what it will look like, would be helpful, because we've got a lot of businesses and organizations who just don't have any idea when they might be able to open or what the conditions would be. and therefore, do they need to invest in new HVAC systems, or what kind of PPE, or what exactly are going to be the requirements? So if there's anything we can do to help them predict that, even if there's a contingency in there, when we do this, when we hit this number, then this can happen, that would be really helpful to people. Some level of transparency and certainty. Sorry.
No, I 100% agree. That's what we're hearing. And even when we come out, or the state comes out with its phase 2, we're hearing from restaurants, well, why was that the case? And then there's this talk about, well, that might work for that type of business, but it doesn't work for my type of business. Staying 6 feet apart can't work if you have restaurant workers who have to come to the table, give you water, bring your food. So I 100% agree with Susan. We're hearing the same thing, the reasoning behind why we're going to different phases and what things trigger, and that do 3 of the 4 have to trigger, or all 4? But they're asking for that information. They want to open, but as everyone has said that talked prior to me, they're concerned. They're also concerned about putting some of their younger workers in that position of telling customers, no, you can't come in. If you're looking at some of these smaller downtown restaurants, they've got young people who are front end. They may be too young to serve alcohol, so they're not waiters. So they're sitting the people at the tables, and they've got someone to come in, and you've got a 20-year-old telling a group of 5, no, you can't come in, you have to wear a mask. So there's some concern about, most people will understand that, but some that won't. So there are a lot of concerns, and then just giving them the information on why now, and then also when things start to tick different ways, are we going to scale back? So that again, they know there's some prediction as best as you can, but there's some things that could be pointed to allow folks to know, okay, well, these things are trending up. They're looking at them, but there's some idea of what the state and the city and the county might do as well based on that number, that information.
So what I see with the state is that the numbers that the state set out to move into phase 2, they were meeting, we as a state were meeting certain goals. I would say 3 of the 4 metrics that the secretary set out, we were meeting, so the state moved into phase 2. But now what I see at a statewide level is that we're not meeting those goals anymore. If you look at the exact same metrics that were laid out originally, hospitalizations and percent positive, we're not moving in the right direction statewide, and Durham is a part of that. So I think that if we're going to be I think the problem that I think a lot of people are going to have who want to reopen is that the reality is that we're not moving in the direction that we want to be yet. And so Susan and Nicole, I think that an honest message using, once we develop, so the state has these KPIs. If we had those same KPIs, the honest message is going to be, we're not ready to be, if those are our KPIs, the ones that the state has developed, we're not ready to be further reopening. And so people are going to have to be able to hear that very, which is difficult for people because understandably they want to get back to business, they want to get going. So I think that saying to ourselves very clearly, what are our local KPIs? And we know a lot of them. We're hamstrung, as Rod has said so many times, by our inability to get the denominator for our one of the key equations on percent positive, but he's working on that and we're doing our best. But with these other metrics, they're not moving in a direction that we want them to move in, and people are going to have to hear that message and be willing to hear it. I think that we should identify what are the 3 or 4 things that we are going to look at. I think that they ought to look a lot like the states, because I don't think we ought to engender confusion in people. Having a lot of different metrics than the state's using, maybe there's one important one for Durham that might be different. But in general, we should be using what the state's using. That'll make it easier for people to understand. And we do have Durham measurements on all of those things except one. And I think that they will tell a very, they will tell the story. I do think that it is also hard. I mean, I think, Susan, what you said, there has to be some contingency built in. I mean, we don't want to say things with, I think the state said something with a level of certainty about phase 2 that was problematic because it's really hard to draw back from that now. And so I just think we have to make people understand that contingency is important, that these are not immutable decisions. So I don't know, those are some of my thoughts.
Can I ask a clarifying question? I've heard lots of good discussion around KPIs and what are the metrics we're following. Are we looking for metrics in addition to the 3 that we identified in our first 2 weeks as being the metrics that we would follow as a task force, which are number of cases, the 7-day average case rate, and then the % positive? Are we looking for in addition to that?
Hospitalizations.
Okay.
Hospitalizations is the other thing I think about. But no, I don't think we ought to be. I mean, unless people have some other big, those comport very well with what the state is doing. And
we can get hospitalizations pretty easily.
Yeah.
I've got that.
And so I think for also the transparency piece and understanding about that, I think it's also understanding like what are we looking at that is success around those metrics, rather than just, oh, we're tracking these things and making this decision, but basically saying like, it's consistently a less than 10% growth, and that's what we're looking for. And yes, this is doing that, or no, it's not. I guess that that's sort of the thing that I'm missing, is the things that's very clear of like, are we meeting this, and this? And what's the duration that we need to meet all of those things to be moving in? And that sort of feels to me like more of the piece that we're missing, rather than, what are we tracking? Because it's been great and wonderful to hear and see all the things that we are tracking, and it's super helpful and informative. But I guess for me, it's like, well, what are our benchmarks around that we're measuring success on?
Okay.
So again, I would say that the state has done that for the state, and that we can. I just think that consistency with them is important. That we can define what success looks like locally in the context of how the state has defined it.
I agree with the discussion, and I think I brought it up a while ago at one of our MAC calls, that it would be great if we actually had a dashboard that literally was, red, green, yellow, where it's very easy to, look at what our key indicators are. What, as you said, Marielle, what is our criteria for success? And that we could, very easy for anybody to just go on the data hub and see, for that, where we are on those 4 indicators, green, red, yellow, and then, for people to be able to track that, and just to be able to say, if we can be on green for, 3 weeks in a row, then, or, for a month in a row, whatever, then we know we're ready to move into phase 3 or whatever. I think, that's what I'm hearing, is that people want some clear definition, and also kind of access to what that criteria is for the community. So I would love to see Rod and Dr. Akinboyo to help us really, come up with that dashboard, and in a very easy, accessible way.
Let me also add that I have been a little bit increasingly concerned by this idea of phases. That phase 3, with the legislature intervening, with the courts intervening, with the governor saying certain things would be in phase 2 that didn't end up in phase 2, that my concern about saying if we hit certain metrics, we will move into phase 3 is what is phase 3? So I wonder if that is, well, I'm interested to see what the governor is going to say this coming next week about, you know, is he still using that language? Or is it, because it's much more ragged than that actually. And so I think that when we think about what our KPIs lead us to, if we are successful, I don't know that we then say that is phase 3. I think we might have to have some more specific definition around what that means. If our cases are X for a 2-week period, then what does that allow us to do with more specificity than just we move into phase 3?
I agree with you wholeheartedly, Mayor Schul, and I think what I'm gathering from this conversation is, as we consider opening more, we've identified 3, and now we have 4 KPIs. We need to spend some time coming up with some tolerance that helps us be able to report out in a stoplight approach. So are we red, yellow, or green? And also spend some time thinking about, so if we stay in the green for X period of time, then what does that allow us to do as a community and not be focused so much on here's phase 3. It should be focused on what are these metrics allowing us to do as it relates to reopening our Durham community. So I got those as action items, and I know we're running a little bit behind, but this has been really, really helpful. It's provided some direction to help us do some planning for pulling some of this together. And Rod and Dr. Akinboyo, I'll definitely be reaching out to you guys to have some further discussions.
Great.
All right.
Thank you. I will move fairly quickly into the discussion around issues emerging from the roundtables. I know you all have the briefing materials. I will just, for the sake of time, maybe quickly highlight a few items that, as I read through, sort of bubbled to the top for me as issues that we'd want to raise for the whole task force. So, under personal services, I think they are, what I'm reading from this is that they are seeking guidance for more specific guidance and guidelines for personal services. What they're hearing is that the guidance is very generic as it is, and so would like some help maybe from the health department on more specific guidelines for personal services here in Durham. And then the other big piece that I saw there, which is interesting, you know, we've had discussions about how we get face coverings, access for purchasing face coverings for our businesses, particularly our small businesses. And what this suggests is that cleaning supplies are also difficult to come by. And that actually, now that I think about it, does not surprise me. We've certainly seen that. So trying to figure out, is there a central way to purchase cleaning supplies to be able to have our small businesses tap into those as well. So that's something that we can maybe even link to that group that's working on the PPE for businesses. Under restaurant roundtables, you know, one of the concerns, and we've talked about it here, is really that they're having a hard time bringing staff back. That staff don't feel safe coming back. And so, you know, I think the more we can help with the face coverings and being able to encourage that and have some level of voluntary compliance at a very high level, that may help with that. Also, requests for infrastructure support, tapping into the funding potentially around their HVAC infrastructure, city donations to subsidize restaurants to feed the hungry in Durham, looking to whether there could be any kind of relief for temporary moratorium on commercial evictions for 6 months after phase 3 to allow restaurants to work with landlords on plans, and then leniency on the ABC license renewal because the price to get licenses and not being able to serve many people. So those are some issues that have come up and some specific requests and I just wanted to raise those up here publicly so that we're moving those forward. And then on places of worship, looking at best practices in safety communicating safety guidance. And I think that is a research question that our students are working on for us. And then on the immigrant and refugee roundtable, lots of ideas, lots of work. We've discussed some of them. The one question I would ask in terms of whether there's been any discussion of this, I know we focused largely on the construction community because that's where we've been seeing cases. But as we get into the summer growing season, how are we considering reaching out to farms and farm workers and thinking about that? So that may be a consideration for that group moving forward. Are there other things that others would like to highlight or other questions that folks have on this?
One that I've seen come up in a number of these groups is that people they say, we're not public health experts and we're not sure what to do. There was a question the other day as they were talking about on the entertainment venue call about the importance of air ventilation. And they said, I don't know how to evaluate an HVAC system and whether this is enough ventilation or what would it take to have more and that sort of thing. And I was thinking, I don't know how we would do this, but it would be great if we had either a hotline number or a SWAT team of consultants or somebody that businesses could tap into when they have questions about what do I do about HVAC, or do I need to put up plexiglass screens in this area or something like that, because they really struggle with trying to figure out the answers to those questions.
Okay, thank you. And just so that everyone knows, we are, so in that template, we're taking those questions back. So we're trying to capture any of the questions that would be for public health to then be able to funnel those to Rod and team or Dr. Akinboyo to be able to get some guidance. But the idea of some type of being able to publicize some type of number where people can call is something. I don't know whether Rod wants to consider that moving forward. It's a good idea.
I think over the course of the weeks, we have been fielding questions from various roundtables, whether they come directly to me or to those public health staff that have been assigned to various roundtables. So we can continue that. We do have a COVID hotline, but we've pretty much, kind of reserved that for the citizens that have like specific medical questions.
Okay, thank you.
The city also has a contact line that I'll include in our chat box.
Oh, great. Thank you so much.
I'm just wondering though about this question, Susan. Rod, would our inspection staff, city county inspection staff, either the staff that goes out from the planning department or from our health department, restaurants inspection staff, would they be able to provide that kind of expertise related to ventilation systems? Do we have that within city county staff, that type of expertise?
I would presume that would come from county staff, the planning department, not necessarily from public health. Public health will really be relegated to restaurants in inspections.
All right, thank you. So I'm actually going to turn it over to Maticia to help wrap us up and talk about next steps for next week.
All righty. Thank you very much. So I do apologize that we didn't have enough time to have an open dialogue about other matters that may be on your mind. But I think we've had a really, really good discussion. But I think just coming out of this conversation, There's more work for us to do around our metrics, and we're going to focus on KPIs and setting some specific thresholds. There's more work that we're going to do as it relates to how do we get people to voluntarily comply with wearing face coverings. I think those were the main items that I got from the meeting today. I know there were some follow-up items that we have from the roundtables. So if I missed anything, Katie, please chime in. But those were the two big takeaways. And my hope is, Rod, Dr. Akinboyo, I'm not trying to put you on the spot, but maybe by next Friday, we can have some dialogue around how those thresholds are shaping up for us, so that we can have some conversations around that.
Absolutely.
You didn't miss anything. The only other thing I would add for next week that we did get a request for right before the meeting was some additional conversation around long-term care facilities and how just understanding how we're working with long-term care facilities. So, and I know that the health department has done a tremendous job with that. So just having an update on that work, I think would be helpful for folks.
All right. Go ahead, Susan.
I would add that for next week, we will try and have progressed the conversation about our communications goals and how we're going to go about achieving those.
Excellent.
I wondered if, I think that's really important. I appreciate that, Susan. And I think, you know, there's just this clear intersection between the communication and the behavioral science. And I think that, you know, really, I thought the dialogue today about that was great. And so Marielle, I hope you can, you know, talk to Susan, that you all can communicate and do some kind of joint thinking. And the other thing is, I was just to our chairs, and is there any other, this is not something to be answered right now, but is there anything else? Are there other, how do we help Ibukun and Rod think about this? I mean, they're going to be able to set the KPIs, but that's different than then saying, okay, these are the other things that could maybe happen. You know, that is in their wheelhouse to some extent, but not totally. You know, what other resource, who else needs to be in the room with them, in the virtual room with them, to think about what are the steps that could be taken if we met these KPIs. So just wanted to add that. I don't think that's totally should be on our public health folks. I think that they need some assistance to think that through. I'm not exactly sure who that is, but I just wanted to put that up.
We'll certainly give that some thought and share any insights that we have. And I'll just say off the cuff, not necessarily about the resources. I think as a task force, we have to recognize as time is spent to develop these thresholds, our first pass may not be perfect, and we may find ourselves in yellow or red, but there may take some conversation, some additional context to help us understand why we're in yellow or red. And my hope is, as a task force, our reaction isn't, oh, we didn't have good metrics. We have good metrics. We're just trying to figure out what is that tolerance that we're willing to accept in the Durham community. And I think that may take a couple passes. All right, so Commissioner Jacobs, are you trying to say something? I didn't want to cut you off. You're on mute.
There's one other issue we didn't talk about today, and I hope we can circle back on this next week, is to get an update from the Vulnerable Communities Committee and from Pilar, just about, you know, what are the barriers that are really out there with the Latinx community and how are we addressing them? Because, you know, even with doing all the contact tracing, at the end of the day, it's going to be things like people having paid sick leave, people not having to go to work, even when they're asymptomatic and they're positive, knowing that they're going to be able to support their families and, you know, have job security. And what do we do about people who are living in very close quarters, you know, big families in tight conditions? You know, I think we just have some very real barriers in the Latinx community that need to be addressed, and whether we need help from this. There needs to be a statewide strategy, because, you know, when we have 40% of our cases across the state being in the Latinx community, this is a statewide issue, and we need help. When Durham is only getting $5.48 million of CARES Act funding, and Wake County and Mecklenburg County are getting $194 million in CARES Act funding, we have a problem. And so I just don't want to lose this other issue when this is where our growing numbers are, and what are the underlying reasons for that, and what are the things that we need to be doing as a community. So we didn't really get to talk about that today, and I don't want to lose that issue. And so next week, if we could circle back and find out how we're doing on that, because these are tough things to address.
Most certainly, we'll make sure that we have that as an agenda item for next week. So many thanks to all of you for the great work that you continue to do, and looking forward to continuing to work with all of you for the next little while. I hope all of you have a great weekend.
Thanks, everyone.
Thank you.
Bye.
Bye-bye.
Everybody.